Are oral piercings worth the risk? Let's talk about how they may put your dental health at risk and 7 ways to take care of your oral piercing to lower your chances of any dental issues. Hi, my name is Whitney and I'm a dental hygienist here to talk about oral piercings. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands of people who have already discovered all of the essential components for an effective oral hygiene routine. I made this guide just for you, for it is an action plan for preventing and maintaining a happier and healthier smile. And on the topic of a happier and healthier smile, for today's video, let's talk about oral piercings. So oral piercings, like most of us already know, they are any type of pierced area on the lips, frenum, tongue, or somewhere else inside of the mouth. Some of the most common areas for oral piercings are the tongue and frenums. By the way, the frenums are the strips of skin right behind the middle of your lip that attaches to the gums and the teeth next to it. And believe it or not, some people even have a uvula piercing, that dangly thing in the back of your throat. I've actually never seen this one in real life on any of my patients yet, but I would be interested to see that in person one day. Anyway, the question is, how do oral piercings put your dental health at risk? There are 3 main risks, starting with number 1, infection around the piercing. Aside from gum and tooth damage, infection is one of the biggest risks of a mouth piercing. Since our mouths are full of bacteria anyway, you have to be careful about cleaning the piercing site because redness and swelling are extremely common when you first get the piercing. And if it's too severe, inflammation can potentially block off your airway, so don't ever let it get to this point. Be sure to keep it clean by following your post-op instructions, which we'll go over in just a second. Number 2, the jewelry can get pulled or ripped out of place. If you aren't careful, your mouth jewelry might get caught on your food, pulled while you're, say, putting on a t-shirt to get dressed, or even displaced if you're kissing someone. And number 3, damage to your teeth or gums adjacent to the jewelry. This is the one I personally see the most with my patients. Gum recession is extremely common on the teeth next to the mouth jewelry because of the constant metal rubbing against the gums in that space. And if you accidentally bite down on the jewelry, you can chip a tooth or break dental work, or if the piercing is rubbing up against your teeth wrong, it can increase your risk of tooth misalignment. This is why the American Dental Association warns about putting any type of piercing to the mouth due to the heightened risk of oral infection, irritation to your cheeks, lips, tongue, and the chances of broken teeth. However, in my opinion, if you are extra careful, it is possible to still have a healthy smile while enjoying your oral piercing. So let's go over 7 ways to properly take care of your piercings. First of all, number 1, when you are picking the type of oral jewelry, what it's made out of can make all of the difference in how quickly your mouth heals right after the piercing by reducing the chance of irritation. So you should go for titanium or solid gold to reduce your risk of unnecessary irritation in the mouth. Fun fact, titanium is also used to make dental implants because of how safe it is, and you probably already know, you have seen that some dental crowns are made out of gold. These higher end metals are safe and hypoallergenic, so you run less of a risk of irritation. Never swap out your jewelry for something cheap. The gold lined ones aren't even great because of what's underneath the gold, so always stick to solid gold or titanium. Number 2, follow the healing time directions. A typical ear piercing or body piercing takes about 6 to 8 weeks to heal, whereas oral piercings take quite a bit longer. Most of them, whether it's to your tongue or your frenum, take a minimum of 3 to 4 months to heal. And some research shows that your body may still be recovering from the oral piercing as long as a year after you get your mouth jewelry. And if you're not careful, you can irritate the piercing site and delay your recovery time. For example, if you clean the area too hard with a toothbrush, or you are always using a harsh mouthwash, like one with alcohol in it, your oral piercing site won't heal nearly as quickly. So be sure to follow all of the directions from the professional who pierced you, including number 3, 0 smoking. Smoking and tobacco products, including vaping, delay healing in your mouth. That's why people with gum disease typically don't see any improvements if they're also smoking. So if you have or you're getting an oral piercing, you should be completely off of tobacco and vaping products. Number 4, rinse your mouth after every meal. Just make sure you're either rinsing with water or using a non-alcoholic mouthwash or even salt water. Anything too harsh, like the alcohol mouthwash, will sting and delay healing, which could cause inflammation and redness. Number 5, avoid kissing? So moving your mouth around too much is just an invitation for the piercing to get pushed out of place, which could tear your oral mucosa. Not to mention all the bacteria that is being exchanged with kissing. I mean, a little peck on the lips should be fine, but save the French kissing for at least 12 weeks after you first get the piercing. Number 6, clean the piercing area as directed. At first, you won't want to irritate the oral piercing, but after a couple of months, you can start to clean around it with a soft toothbrush. Make sure to always do it ever so gently. And again, always follow the individual directions from the professional who placed your individual mouth piercing. They know exactly what you should do for your personal situation. And lastly, number 7, get routine dental checkups and cleanings. And at your routine cleaning appointments, be sure to have your dentist check around the mouth piercing during every exam. They'll want to make sure the tissues are healthy, there are no signs of gum recession, and that the jewelry isn't rubbing or chipping off any tooth structures. You know, repairing broken or worn teeth is a lot more expensive than the oral piercing itself. Repairing teeth is very expensive. You know how expensive dental work can be. So there may be cases where your dentist recommends that you consider removing, getting rid of your mouth jewelry if unwanted side effects begin to occur. This isn't always the case. Unwanted side effects don't always occur. But if they do, or if they are suspected to, your dentist is the best person to monitor that area and give you advice and recommendations on how to handle it to decrease needing dental work and increase your chance of a happy and healthy mouth. Speaking of a happy and healthy mouth, if you are interested in creating the perfect oral care routine to prevent major dental issues and avoid costly dental visits, make sure to click the link in the description below or in the pinned comment to sign up for my free oral care guide and join thousands of people who have already discovered all of the essentials for an effective oral hygiene routine. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.